Mabuhay, this is Bob from Love Beyond the Sea, and I had someone contact me on TikTok, and they asked me a question I thought enough about to make a video about. What do you do when you bring your Philippine wife over to your country? What do you do for health insurance for her? Because a lot of guys aren't working, and so a lot of them don't want their wife to work either. So then who's going to pay for her health insurance? That's what I want to talk about today. And if you have gone through this before, thought through it before, I'd like to know what you ended up doing, because I do wonder, like if my situation were different, what would our options be? I was working when my wife got here. Then we were both working. And then I had early retirement and she's working. So both of our health insurances has been on an employer plan. But if, let's say I were married to her and then I retired, well, at 65, I'd get, Medicare. But what about her? So I think working is an option. I want to tell you about this healthcare.gov. Is healthcare.gov going to be the answer, at least temporarily? If you bring a Filipina over here, I think you have to have some kind of health insurance. And this Obamacare, which is what, healthcare plan is, Affordable Health Care Act, I think it's expensive. If you go to the healthcare.gov, which I recommend, healthcare.gov site, you put in your zip code, and then for some reason it gives me 107 different plans, but I'm sure there's more than that, but that's just what it does here. I've been to my financial advisor and they pop up on, I think it's this site, and they can find all the plans. And then they've got a place, tell us about your household, current plan, household income, estimated savings, and then there's some other things to look at. You can skip these and see the full plan prices. For example, if I put in my zip code, there's like 107 plans broken down into 50 bronze plans, 32 silver plans, 25 gold plans. And the more the average premium is up, then the deductible is lower, as you might imagine. So what I put in there, just what they showed me for a 35-year-old person. I'm not 35, but that's their default unless you get into it and then you change it to older. $459 a month premium for the one plan, $569 for the other one, and then $596 for the so-called gold plan. I'm sure you can spend a lot more than that, but if you go in there, you'll be able to look around, and you can sort by lowest premium, lowest deductible, and I just saw that now. I guess I'm set on lowest premium because the first one that comes in here is $360.39. These are expensive. You should check this out, healthcare.gov. If you want this plan, and $360.39 is very cheap for health insurance. Well, there's a cost. There's a price to that. And the deductible is $9,100. And if you hover over that sign there, it says the amount you pay for covered services before the plan starts to pay. $9,100. Out-of-pocket maximum, same thing, $9,100. So this plan, you better have $9,100 to pay for something. Let's say something really bad happens, $20, $30, $40, $50,000 surgery or procedure or more, or a bad year of needing procedures and follow-up. Well, here you'd be paying that $360 a month plus your deductible of $9,100 before you see any kind of benefit at all. And then their co-payments and co-insurance, like for doctor's visits in emergency room and specialists, they don't even have that. It just says no charge after deductible. That's the same as the out-of-pocket maximum, $9,100. You're going to pay anyway before you get any benefit, and you still have to pay that $360.39 a month, or you get nothing. And then they have all these different plans. I've got, I think, 11 pages. I'm not going to go through those, but Very similar, this next one, you know, $377 a month, but deductible $8,600 before they pay anything. Out-of-pocket maximum, the very same thing. And, you know, if I was to switch up here and go to lowest deductible, well, that would look like this. This first one here, monthly premium $608. That's still good for insurance these days. Very good. This is called the Elite Gold Plus Vision Plus Dental Plan. Deductible is $0. Out-of-pocket maximum $5,000. That would cost for emergency room care 30%. I think that's what, I don't know if that's what they would pay or you would pay, to be honest with you. Primary doctor $5, which is nothing. Specialist doctor $60, which is nothing. Generic drugs $14, which is nothing. So it has plan details. If you want to click on that, maybe I will, because this sounds like a pretty good deal. Out-of-pocket maximum $5,000. That's what that is. It is what it says, and no deductible. But then when you start using it, you know, you will incur some costs, and that really doesn't look like too bad of a plan compared to the others, to the other one that I gave. So you'll have to go into that site and look at the best situation, lowest premium, lowest deductible for, you bring your Filipino wife over here, and let's say she's not gonna work yet, maybe for a couple years or so. She needs insurance. And if the man is retired, doesn't have insurance, or can't get insurance for somebody else, like a spouse, and she has to do it on her own, then I think the Affordable Care Act, otherwise known as Obamacare, is the only option that she has. So I'd go to healthcare.gov and look at these prices, put in your zip code, and see what's available. And you know, zero deductible sounds great, but you're paying $608, or she is, a month for that. And then you have primary doctor, of course, your prescriptions. You always have to pay for some of that, but that really doesn't look like too bad of a plan. It's either that or let your Filipino wife work. I just did a video about benefits of a Filipino wife working, where she is with you after immigration. And so just to save on this insurance cost, because you can get a much better insurance coverage, I would think, through your employer. But if that's not possible, consider healthcare.gov. If you're in America, I don't know if other countries have anything like this, you know, how they work out all the numbers and the treatments. I don't know. Maybe some countries, everybody has it, but that's not the way it is here in America. So it's either that or let her work. Let me know what you think right here on Love Beyond the Sea.